been a hospital leader, as you mentioned, since it was first implemented. What, in your opinion, is the biggest success and the biggest failure of the ACA?
Biggest success and biggest failure. Let me just take one step back. And we've been living in this really since 2010. And I think it was signed into law March of 2010. And the original version of this was called the Patient Protection and Affordable Care Act. You know, and it's been coined in, you know, lately as Obamacare and ACA. But in the beginning, you know, when you think about success, the focus is on quality and transparency and payment reform and access and many, many things that we really believe in, particularly as a Catholic health system. So we've been living in this law, you know, since 2010 in some way, shape, or form, and prior to that, preparing for it. And so today, you reel the reel forward, and there are issues, right? There's no doubt there are issues, but we know what's important to us is access, 100% access. It's the fabric of who Ascension is as an organization. It's the fabric of Catholic healthcare and what we're doing to make certain that we take care of the poor and vulnerable. We want to preserve that, you know, when that's important to us. The individual marketplace has been tough, right? But we know we need to strengthen the individual marketplace as part of, you know, the future. And so as we sort through this, there are a lot of opportunities for improvement. And then really the last part about it is, if something does happen, we have to preserve the gains. And any savings we get, we've got to make certain we're reinvesting back into our health delivery system and that we protect those savings and they don't get, you know, siphoned off for something else. And so when you think about us living into the law, being in the law, and really shaping the future of healthcare, when you talk about quality and patient experience and transparency and lowering costs and fee for value, there's a lot of things that we're doing to shape the future of it under the pretenses of the Patient Protection and Affordable Care Act. It hasn't been perfect. There's a lot of work to do, but we're committed to being part of the solution.
Deb, what about you? Biggest success and biggest failure of the law?
A couple things. First of all, the main construct, as Travis, as you said, the main construct was giving people accessibility to health care. One of the main principles behind it was keeping people healthy. That was a main driver of the Affordable Care Act, to make sure that we had access, that we had primary care physicians, we had the ability to keep people healthy. And I think all of us have seen that happen as we've had people come into our hospitals, where we've seen less on the hospital side. Eric actually talked about the expansion of our membership in WHA, less hospital-centric focus and more in terms of population health. Keeping people healthy, driving people, ensuring that they have a relationship with a primary care physician, with a medical home, so that they're able to take care of themselves and have that accountability to take care of themselves, and we give them the resources to do that. That is something I think we need to applaud, because that has been successful, and every single health system in the state has stepped up to do that. That's one of the great things about it. I think one of the challenges we have is for some of our people, and it sort of goes into what is Wisconsin going to do, but the affordability in some respects of rising insurance premiums, those kinds of things that have sometimes inhibited people of stepping back and enrolling in the exchange programs or enrolling in the various products. And we've got to be able to address that going forward, both on the payer side to help the payers, but also at the bottom line, it's about the patient. It's about the patient having that access 100% of the time and affordability.